My name is Dianna Abney. I am the health officer for Charles County Department of Health. So as you know, COVID is still among us and flu season is approaching. So let's talk first about COVID. You all know that COVID symptoms are flu-like symptoms, fever, sore throat, cough, and those kind of symptoms. So first of all, let's talk about what you should do if you feel like you have COVID symptoms. You should isolate yourself, talk to your physician, and get tested. Also, you should remember to prevent yourself from getting COVID and to prevent spreading it should you get it to others. You should wear a face covering or a mask to make sure that you're not spreading germs to other people. And in addition to that, you should get tested if you think you have symptoms. Also, it's a good idea to get tested even if you don't think you have symptoms, because that helps us figure out what the positivity or what the amount of COVID is circulating in our community. Now let's talk a little bit about flu. Again, similar symptoms, and since flu season is approaching, one of the most important things you can do is to get a flu vaccine, because flu vaccine helps protect you from the flu. By the way, starting in October, the health department will be offering flu vaccine at our clinics. They'll be a little different this year. Rather than coming in and walking in, they'll be drive-up clinics, and you should be hearing more about that on the news in the near future. So I am returning to you as the health officer. I was a health officer for almost 6 years before, and I had a break of 2 years, or almost exactly 2 years I had a break of. I like serving people. I mean, I'm a physician, I'm a pediatrician. That's kind of what we do anyway. And when there was a need to come back, I took the opportunity to do it. I love Charles County. I've worked here for 25 years, actually a little more than 25 years. And I love the community, I love the residents, and it was an opportunity to give back to what I consider my community. Even though I'm the health officer, I'm still a practicing pediatrician. In Maryland, if you're a health officer and a physician, you are allowed to still practice as long as that practicing doesn't interfere with your duties as being a health officer. So I see patients 3 days a week for a couple of hours before I start my practice here at the health department. And people ask me sometimes, well, why did you want to be a health officer? And I said, well, when I was a pediatrician, I got to take care of and make a difference in the health of 20, 30,000 people in Charles County. But as the health officer, I get to make a difference or help make a difference in the health of the entire county. And part of what I really like doing and what I did before was make sure that my staff gets credit for what they do, and that people understand that the health department is not just where you get a flu vaccine, although it's flu season and it's time to get your flu vaccine. But the fact that you can go and safely eat in restaurants, the fact that people's septic systems and wells are safe has to do with our environmental health department and the work that they do. The fact that you do get those vaccines, the fact that there's some reproductive health care given for women who need it, the fact that there's dental care given for people who need it or choose to get it here at the health department, the fact that there is screening for breast cancer, and the fact that we have HIV services, that's all done through our nursing department. The fact that there are people who have disabilities, developmental disabilities, that get services and are helped to get jobs and things like that is taken care of here at the health department. People who need to understand or need to get some teaching about healthy lifestyles to prevent diabetes or to help them manage their diabetes comes out of the health department. So there's a lot more that we do than just flu vaccine, and we want to make sure, or one of my goals is to make sure that the health department is seen as a place that is for everybody in Charles County, not just one or two, or not people who are in need, but everybody in Charles County benefits from the health department. Like I said, it gives us a chance to serve the entire county. And it's not one person, it's this entire staff who works tirelessly and is very committed to serving this county.
There's good news from our Department of Community Services housing program. Look for upcoming podcasts where we share our news and talk about the program with special guests. To listen in, visit podcast.charlescountymd.gov. Listen in your home or on the go.
Hi, I'm Renisha Miles, your Community Engagement Coordinator with Charles County Government, Here to remind you to register to vote. The deadline is fast approaching, and we want to make sure all of our residents are registered to participate in the upcoming general election. So don't forget to register to vote. Check out the information on our Board of Elections webpage for instructions on how you can get registered. Also, don't forget to request your mail-in ballot if you would like to vote by mail. There are also early voting options in many locations throughout the county. So if you'd like to vote in person, that is always an option for you as well. So register to vote, request your ballot, or vote early. Don't forget to participate in the upcoming general election.
Hi, I'm Sandy Washington, Executive Director of Lifestyles of Maryland. We've been in Charles County for about 24 years now, serving those that are underserved and or those going through a crisis in their lives. Through COVID-19, I think what's really on everybody's mind and what we're facing and anticipating is trying to mitigate the number of people that will become homeless. Dealing with evictions and folks trying to work through this process of loss of income and being impacted by COVID-19 and not knowing how to pay their rent or whether they should pay their rent while they're trying to take care of other things. So as a group, we've been working collaboratively with other partners in our community. I am so proud of Charles County that we did not wait till the end of this and did not wait to see the impact, but we have been working together all along and we just strengthened those partnerships. If you are, our Department of Social Services, Southern Maryland Tri-County Community Action, the United Way, the Salvation Army, all of those partners coming together to assist in helping people as they get through this process of not being evicted and trying to stay in their homes and stabilize their lives. What we're doing now, and I, along with county government, is looking at educating our community. I think it's so much education that has to be done to let people know on all sides what some of the needs are, why people are facing evictions, who people are that are facing these evictions. Our program, the Assistant Director of Lifestyles, Corae Young, is going to share with you a little bit about our programs and how these things impact our programs. The idea is not to recycle people. We don't need to take people out of their homes and then put them in a state of homelessness where we won't find a place for them to be. And once those folks are evicted, their credit ratings, all of these things will impact them finding stable housing later on. So right now, we're looking at what we can do together and with all of our resources to make a difference. So when Corae shares with you what the community can do, how each person has to play a part in this, because we can reach out to some, but we also have to know that everybody has a neighbor or a friend or a family member that you can share information with. And hopefully through all of this, the information that we provide is something that they'll be able to share with each other.
Hi, my name is Corae Young. I'm the Assistant Director at Lifestyles of Maryland. There's actually two things as far as people misunderstanding the situation. The first part is moratorium did not mean that people should have stopped paying their rent. It is very critical that those who are renting show some good faith effort towards paying something towards their rent during this time. It's critical because the judge, if you ever have an eviction court hearing, is going to want to look at that as far as your ability to pay and your ability to sustain. The other thing that's also being misunderstood is that everyone was not eligible for the federal unemployment stimulus money. And so we have families who may have been impacted because of loss of income due to someone in their household dying from COVID, or loss of income due to someone being affected and no longer able to work. So when we talk about somebody being impacted by COVID, it does not necessarily mean everyone had sufficient income during this time to maintain their rent. It's absolutely important that people start the process now. While the CDC moratorium is through December 31st, we are strongly encouraging people who might owe multiple months of rent to start working with local agencies to get access for financial assistance, because there may be in January where there may not be sufficient resources to help them. So it's very critical that they start that process. It's also very important that if they do get called for a court hearing, the judge is going to ask whether they have tried to solicit any support from any government or agency sources. So that is also going to be a critical piece for them to take to court. So it's very important that persons complete the CDC, the Centers for Disease Control, the declaration page. That should be provided to their landlord to show that they are legally stating that they have not had the ability to pay their full month's rent. And that is important to provide to the landlord and to also keep proof of that declaration so you can show the judge that you did submit that. It's also important that persons show any income and any expenses that they had during this time and any payments that they made to the landlord to show good faith effort. The great thing is that as part of this collaborative, there's a no wrong door approach. So any of the agencies that we shared on this screen, you can go to them either via phone, via email, or scheduled appointments, and you can access resources from other community partners. So wherever you go in this collaborative, you will get the support that you need. So if agencies or other organizations want to help support our cause, it's very important if you'd like to donate to one of the agencies that are listed as part of the collaborative, that's an opportunity. And it's also important for people to be educated. So to share this information with others that you think might be impacted by COVID, letting them know that there are resources available to them, but also letting them know that if they have not started making payments towards their rent, it is absolutely essential that they try to send something. One last reminder, just to let everyone know that moratorium does not mean to stop paying your rent. You are still fully responsible for your rent accruing during this time. So it's important to start the process now of getting the help you need, because it's either you pay now or you're going to pay later.
Applying for jobs with Charles County government is now easier and more efficient. Visit www.charlescountymd.gov for more information.